Hi, I'm doing a video on surgery I'm having tomorrow. It is a posterior fusion of the C1 and C2 with screw and rod fixation. The reason I'm doing this video is to document the surgery and recovery for anyone considering this procedure, as when I learned that I was going to have the surgery, there was very little information out there from other patients that have had this, so I'm hoping it might be useful for others in the future. A little background on my condition is I have an arthritic condition on the right hand side in the C1, C2 that are causing a lot of pain. It was initially aggravated by a car accident 21 months ago, and the accident also caused a herniated disc in the C4, C5. Initial treatment was physical therapy. I also had several months of chiropractic treatment, several nerve blocks, injections, and drug treatment as far as NSAIDs and painkillers, and they didn't help. I had severe pain in the side and also in the back. The neurosurgeon decided best treatment would be to do a disc replacement of the C4, C5 disc, which was done 11 months after the accident. The hope was that the stabilization of the area would also correct the issues up here, or at least relieve it. Surgery was successful as far as this pain and the disc herniation, but the upper neck pain at the base of my skull continued without any relief after the first surgery. After the disc replacement surgery, I went back to more chiropractic care, and also several more injections with really no results. I also had the Botox type injections to try to relax the area, and continued the drug treatment, and it did not cause any significant relief. At that point, I came to Duke Spine Center, at which point I met with the current physician that I'm dealing with, and with some future medical imaging, it was determined that the C1, C2 area was contacting and causing the pain that I have. I initially had 2 more CT injections that were hopeful for relief and also diagnostic to determine the correct action, and it was determined that the best would be the C1, C2 posterior fusion, at which point I am scheduled for this surgery tomorrow morning at 10 o'clock. I had my pre-op appointments today, and we're all set to go. Just a little bit of what I'm dealing with is I do have head movement up and down. That is with some considerable discomfort, but not awfully bad. I have virtually no movement left and right, and that any of that type movement causes severe pain. So I will continue on the other side of the surgery to document my recovery, and hope you find it useful. Alright, right now we are post-surgery. It is 2 weeks and 2 days since the surgery. My original intent was to update the video every day after surgery. However, I changed my mind because honestly the first 5 days after the surgery I would have had a hard time recommending this to anyone, because it was very painful, more so than I expected. However, since then things have continued to improve, But first, I would like to talk a little bit about the surgery. I had my surgery on a Friday morning. The surgery lasted approximately 5 hours. I was in the hospital the day of the surgery, Friday, also Saturday, and I was released late Sunday afternoon. It's a normal hospital stay. I was in a lot of discomfort. It is unusual because you have surgery to the back of your neck and you also have it to your lower back for the hip bone that they used in your surgery. The hip was actually a little more painful than I anticipated, as they said they use a small piece of the bone for the fusion. However, they take a larger, more generous piece out of you to get the actual piece they want to use. So I was surprised at how much the hip hurt, but it's all good so far. I guess the first thing I'm going to do is show you a picture of the incisions, just so you get some idea. If you're a little faint of heart or don't like that kind of thing, you may want to turn away. And when you hear me talking again, the pictures will be gone. So here they are. Okay, so as I said, I was released on Sunday afternoon and actually went to my brother's home for my recovery because I had this surgery out of my hometown and I needed to stay near the hospital. They wanted me here for the first month for recovery and follow-up checkups. Like I said, the first 5 days were really uncomfortable. They gave me, for the pain, OxyContin. As it turns out, my body is not a big fan of those drugs. So by that Wednesday, I was anxious to get off of them, and they put me on a milder non-narcotic pain relief, which I only used for about 2 days, and now I am using strictly over-the-counter, excuse me, either ibuprofen or now aspirin-based products now that I'm more than 2 weeks out of the surgery. The actual Saturday after the surgery, they got me out for the first time for a short walk, and then again on Sunday before I was released, you see a physical therapist who you do some walking, demonstrate that you can get up and about so you can go home so they can clear you. So like I said, I came home on that Sunday. It was probably Wednesday before I was kind of with it because of taking the narcotics for the pain. Sleeping was difficult because you can't get comfortable. It hurts to lay your head back on a pillow. It hurts on your side to lay on your back. It's actually kind of in your upper back, just to the side of your tailbone is where the incision is. And so it's uncomfortable on your back. It's also uncomfortable on that side. And just moving during the night is relatively uncomfortable. About day 6 out of the surgery, I ventured outside for the first time. My wife and I went for a very short walk. You get tired easy, and you actually just get tired of holding your head up because I think mostly just from the trauma of the surgery to your neck muscles and that type of thing. But by then I was on the upswing, feeling better about the whole thing. Probably by the following weekend, I was out and walking probably a mile, shortly over a mile. And now at 2 weeks and 2 days, I'm walking about 2 miles a day. Doctor said walking is good for the recovery and a little exercise, that kind of thing. Your balance is a little off, and your leg hurts a little bit from the hip portion of the surgery, but you can get around pretty good. We've been out shopping, that type of thing. And so as far as movement, you recall I had very little motion left and right before the surgery. It was mainly, I believe, because of the pain, because when I was in traction before the surgery, I had almost full range of my neck motion left and right, but just couldn't do it. Now after the surgery, it's a little different. I do not have any of the pre-pain, but now your neck motion is limited by the fact that the first two vertebrae are fused together. So, you can go, you can see what I'm capable of there. They say that may expand a little bit in the future. You're supposed to, for the first 3 months, take everything very cautiously. No lifting, just very light things, nothing over your head. They want you to limit your neck motion to just what's comfortable, and they want you to really limit your neck motion going up. But they say I will have much more extended range up and down, which I do now, but they don't want you to push it as far as going up. After 3 months, they will start therapy where you can start expanding and doing exercises to push your neck a little further. And at 6 months, they anticipate the fusion will have set in, and you can really, start cranking on your neck to see how far it will go. You're just a little hesitant now to just do more than that, but that's more than I had before the surgery, so I'm good with that. The pain, as I mentioned earlier, it's not awfully bad after the first week. I'm doing it just totally with over-the-counter. It's just a little leg discomfort, and that's about it. I am going tomorrow, which will be 2 weeks and 3 days out of the surgery, to have the stitches removed, and at which part my doctor said I will be released a little early and I am good to go back to my hometown. Ideally, they want to have a follow-up at 6 weeks and at 3 months, but because I'm a great distance away from here, we're going to schedule something in the middle of that, and that will be the next time I see the doctor. Overall, being a little over 2 weeks out of the surgery, I feel good about it. I'm in less constant pain than before the surgery. I feel, optimistic about the future, and I will try to update my recovery about every week or so. Also, just a note on exercise. The doctor, as I mentioned, did say walking is a good exercise. He also said I could be using a stationary bike and an elliptical at this point. They don't want any impact, no running, anything that's going to jog the surgical site. And like I said, no lifting. He said probably up to 10 pounds, keeping it all below your waist. And for a while, no serious bending over from the waist. So, hello. We are currently a couple days past week 5 out of surgery. I am back home. Came home after the 3rd week. In the last video, I said I was on the way to the doctor's to have my stitches removed. He determined he wanted to wait an additional week, and so we took the extra week down there. We went to the shore for a couple days. So I had the stitches removed just after week 3. He said that might cause a little more scarring, but as a nearly 60-year-old man, that's not a big issue. So I had the stitches out. I believe there was 13 in my neck and 8 in my back. The incision sites are healing well. I do have a little bit of sensitivity on the neck. On my back, there is no issues. That's fine. I think I forgot to mention before, I did have a lot of pain from the incision on the back, but I also had some leg pain at like week 2 and 3, and kind of just shooting down the leg. That is totally gone, and I have no issues there. As far as movement, I do have slight, I guess just because of the type of surgery, you're not going to get a a whole lot. When we start doing therapy at 3 months, or in 6 months, they anticipate getting some of additional movement from the lower vertebrae. Almost all the neck pain that I had prior to surgery is gone. I mean, I feel fantastic. Best I've felt in several years. I do have some of the headaches that I used to have before, but they're much less frequent. They typically start later in the afternoon as the day goes on, and if they get bad, I can just take a couple aspirin and that seems to handle it. As far as medications, I'm on nothing now for pain. I think I just went over the counter after less than 2 weeks, and I've stopped all that. The only thing I will take is Motrin PM at night before I go to bed, which is a lot less than I used to have to take to get some sleep. I anticipate getting off of them very soon, sleeping through the night, and so far so good. When I did get back home, I started going to work. That was right after about 3 weeks out of surgery. I am self-employed, so I had to, get back to the office. At about 3.5 or 4 weeks, I was starting to run a fever, and based on my daughter's advice, who is an RN, she suggested I'm overdoing it. Took it a little easy, and after a couple days the fever had stopped. I'm currently working a half day. I do light office duty, no heavy lifting, anything like that. I typically knock off early afternoon, come home, rest for a while. Then I can do some additional work from home that I'll take care of. But still taking it a little bit easy. Overall, I feel great. Like I said, better than I have in several years. I'm healing fine. If you have any condition like I had before and are hesitant about this surgery, work for me. I mean, I won't recommend any medical advice to anybody, but so far so good. And I'll check back in a few more weeks. Okay. Tomorrow will be 13 weeks since the surgery. I'm still feeling very good. No real problems with anything. I have had some neck pain. It's more muscular pain. Kind of shoots down here every now and then, but it hasn't been a big issue, and it's usually after like I'm sleeping in an awkward position or something, but it's no big deal. As far as movement, still not a lot, but it's something we'll work on when we start therapy after my checkup. I have the 3-month checkup 2 weeks from now. I'll be back down in North Carolina for that. And as far as everything else, like I said, I feel really good. The headaches are virtually gone. Occasionally I will get a little bit of a headache there, but it's no issue. Not on any painkillers for any of the surgery. The incisions have healed nicely. I will add a picture of the incision on my neck after this, and I'll check back after the 3-month evaluation by the surgeon. Okay, we're at the 1-year mark since the surgery. I know I was going to update more often, but life got in the way and I didn't do it. I actually had a really good summer, first good summer in over 3 years, so I was back to doing a lot of my normal things and keeping busy. First, let's talk about motion issues. Good up and down. You're just not going to get a whole lot back left and right, because with 1 and 2 fused together. I have a little less because of the fusion at C4 and C5 because your lower neck is going to pick up all the motion now with the lower vertebrae, and so you're going to get some. There's no pain. There's no pain related from the surgery, and overall I feel pretty good. You will get tired if you're in situations where, because what happens with that movement, instead of moving your neck, you're going to have to move your upper body and your shoulders. So like if you're in a social situation, in a gathering where you'd normally be turning your head left and right, you're moving your whole upper body and putting a little more strain on your lower neck. So after a long period of that, you may find your neck hurts a little bit and that kind of thing, but it's not that bad. One of the things I wanted to talk about is the changes that you will find that you have to make in your day-to-day life. When I was considering the surgery, my surgeon said, you make the call when to have it because it is a life-changing situation. So I made the call when I just couldn't take the pain anymore. And he was correct. Things are going to change after the surgery. Because as I mentioned, your movement comes from your upper body, not so much your neck. You're going to find things that just sitting, going out to dinner and things like that, I find that I select my chair strategically because I'm not going to be able to turn around and talk to the waitress or people sitting left and right. So round tables are good. I like to sit in the corner of a table so I can see the restaurant. You can talk to the waiter or waitress a little easier. Just walking, things like that. You're out for a stroll. It's a little more difficult looking left and right. Probably the biggest issue you will find is driving. Even just getting to your mirrors is tougher, and you just got to be a little bit more careful. Looking for cars, you're not going to be looking over your shoulder like at your blind spot, or looking over your shoulder when you're parking. So you're going to rely a lot on your mirrors. There's none of this where you can get all the way back and turn around and see what's going on. I had to get a new car anyway, so my wife's car already had it, so the new car I got has the backup camera. It helps a lot. I know it sounds strange, but I had talked to some people that had the surgery before, and driving can be an issue, so you just got to be more careful. You're driving along and whoever's with you says, oh, look at that house over there, and it's something you got to look straight left or right where you used to turn your head. Just got to let it go, and you'll realize that after time. But it's just the fact that you're limited as to where your head can go and what you can do, and you're going to find that in walking, driving, just your normal everyday life. After my 3-month checkup, I got the clear to do whatever I wanted to. I could go back to whatever was comfortable, he said. I'm actually back to running occasionally, 1 or 2 times a week, just a couple miles. I golfed all summer long. I'll address that in a minute. I actually been out on my bike a few times. It gets a little difficult, and you're gonna have to be careful and adjust to the fact that your movement is limited when you're riding a bike, but pretty much you can do whatever you want. Golf is one of my favorite activities. I enjoy playing it a lot. You are going to find out, if you are a golfer or whatever sport you have, that your head would normally turn like in a golf swing, is your head doesn't go. So the golf swing was a little different. Took some adjustment. I went where I used to be about a 1 or 2 handicap. I got up to, I hate to admit, about a 10 handicap for a while, but I've got it back down in the 3 or 4 range and hope to improve on that next year. But pretty much you can do whatever you want that you're capable of. As a final note, I wanted to just give a couple thanks out there. May sound a little bit corny, but I wanted to thank my family and friends for their support and putting up with me over the last 3 years as I battled with some of these issues. My brother and his family for putting me up while I was in the Raleigh area for the surgery and the recovery, and especially my wife, who has been my caregiver for the last 3 years and has done very well. But also I would like to thank the staff and medical people at Duke Raleigh. That's where I had most of my testing and checkup done, and the staff, and especially surgical staff, and the hospital staff at Big Duke in Durham, where I had my surgery. And in particular, Dr. Linda Gray, who performed many of the tests and diagnostics before my surgery, for her attention and just her caring. And Tanya, who was my surgeon's assistant, who was just great in all the time I was in Raleigh. And more than I can ever really thank, I want to thank Dr. Keith Michael at Duke. He is now at Emory, but essentially I don't know where I would have been if he hadn't made the diagnosis and done the surgery. He's a great surgeon and a very caring person, and I want to thank him and everyone a lot. Well, I hope this video might shed a little light on this type of surgery if anyone is faced with it. I will leave notes and any special links in the comments, and a way to get in touch with me if you ever had any questions, and good luck with it if you have to have it done.